My name is Jamal غوشه. I'm a consultant neurosurgeon. I'm a trustee and a founder of Physicians Across Continents. We're based in London, United Kingdom. Well, part of Physicians Across Continents objectives is basically to take care of crises wherever they are, regardless of the ethnicity or religion, or once anybody in need, we used to attend through our teams. Our teams are of specialized consultants in almost all specialties. The admin office, once they recognize an international crisis, like what happens in Rohingya, they immediately send an exploratory team to try to locate and assess what exactly the situation like, how bad it is, and what's really needed. And this is what really happened at the Bangladesh border. A team was sent, and they explored the situation, and they came with that everything is needed, really. And subsequent teams in the form of medical trips comprised of consultants in every specialty went there, and on successive visits, and they started the work. Well, once we were there, I mean, basically everything was needed. Anything you name it, it is really needed. I mean, the lack of facilities, I'm not talking about sophisticated medical equipment, I'm talking about lack of facilities for basic investigations, basic health issues, like you don't have a basic laboratory, for instance, for you're talking about 800,000 or 900,000 people. They don't have a laboratory. You cannot get a CPC, a complete blood count. You cannot get a urine analysis. You cannot get a basic blood sugar. And this is catastrophic, you know. If somebody falls down, or somebody has a fracture, a gunshot or whatever, you cannot get an X-ray to confirm a fracture. And this is something terrible. The way you do it is you have to get to go through all the bureaucracy, all the way, get permissions and all that, to get them to the nearest city, which is Cox's Bazar in that case, which is, we're talking about 2 hours journey with difficult transport and bad roads and all that, to take the patient to get this done, cleared, and get him back again. So I'm not talking about serious diseases. I'm not talking about patients who need serious surgeries, life-threatening situations. I'm talking about day-to-day conditions. Well, I think the best people to answer this would be those who work for the WHO and the international health societies. But from a basic look from the few trips our teams have conducted there, you're talking about a need to, because of lack of proper sanitary conditions, lack of water, lack of right sheltering and all that. That exposes the people there in the camps to lots of troubles, and as usual, the kids, children, particular sector affected mostly. High temperature, children being febrile is a problem. Just simply they're getting paracetamol, which is something just to calm down the temperature. And that's all that can be done there. Now, among those children, for sure, my colleagues as they've told me, and as we've seen, they miss the more serious ones, like the meningitis cases, the cases with pneumonia, cases with with severe otitis media, ear infections, and so on. So such conditions for kids, they're normally curable, normally treatable, easily treatable once the facility is available. But if you don't have the basic facilities, again, it's a trouble. The treatment is either wrong or incomplete by giving a short course of antibiotic, and who knows even if the mother is really compliant, giving the medication the right time, considering their bad standards of life, and so there are lots of conditions, lots of diseases that really have a great impact on their daily living. Well, there are many stories. What comes to my mind now is, being a neurosurgeon, I came across a good number of patients who sustained gunshot injuries to their nerves, peripheral nerves, whether in the limbs, in the legs, or in the hands, and causing fractures. And one of them, a girl, was like a 6-year-old girl who is, her name is Minarat. She had a gunshot injury to her leg, and unfortunately that broke the bone and caused compression on the nerve. Should that compression been removed in the right time, it would have made a dramatic change in the outcome of the injury. So we had to take care, although late, but operate and try to do this as much as possible in a better way. This makes you feel that why not done earlier? Again, the lack of facilities made it not possible. Another kid, I remember, there are many patients, especially kids. One who had a slowly protruding eye, and once the pictures were sent to us, we realized that this is a growing tumor from the eye, and if it's not gonna be treated, it's gonna kill the baby, the child. And with the help of my colleagues, a plastic surgeon and an anesthetist, pediatric anesthetist, we were trying to go together, me as a neurosurgeon and with my colleagues, to operate on this child. Unfortunately, we hear that he died like a couple of days before we were there. And the tumor went big enough to kill him. I mean, there are many conditions. They're basically treatable, and one can do a lot of better job once they're attended earlier. Unfortunately, they leave an impact on you, because it's not because, we know in all the specialties there are diseases that you cannot cure. That people die every day in hospitals. I'm not talking about this. I'm talking about conditions that are treatable and curable, and we don't have enough facilities, basic facilities, even to do this. A child or a man who dies of pneumonia because of lack of proper antibiotic, because of lack of proper investigative measures like simple chest X-ray, or even the right doctor available to diagnose him, examine him. A child who has a temperature, not diagnosed or not treated well, or treated wrongly, continues to be into meningitis. That's really a shame, because if the right investigation, the right doctor, the right facilities available, these are all avoidable. Well, physicians across continents, it's as the name implies, it's basically it's an organization, as I said, based in London. They through its worldwide team, they attend people in crisis, health issues. their target is to help people by either making the proper diagnosis available, operating on them, and again make facilities available once applicable, and advanced education at the same time, running conferences, workshops for local doctors to carry on with the visiting doctors, and basically this is the main target of physicians across continents. When it comes to Rohingya, and unfortunately the facilities are very poor and very basic, so they need to, physicians across continents, and I guess all other organizations all over the world who are concerned with health issues, they have to upgrade the facilities to a level that people can really reach a stage that they'll be able to do something. As I said, we need a mini laboratory at least in the area. We need a mini theater, surgical operation room, and again, the staff is available. The facilities are not yet. Again, communication with hospitals in nearby cities, and again to do these surgeries and refer these serious patients to these places. My message to my colleagues all over the world, doctors, nurses, operation rooms staffs, is try to spare part of your time during your years of work to offer to people who are in need. Life is not only working in a very optimal situation. I'm talking to doctors in particular. The situations, the facilities which we do have in UK, in Europe, in good number of countries in the Middle East, it's not unfortunately available to vast majority of people all over the world. So as a neurosurgeon, as a vascular surgeon, as a general surgeon, as a physician, a cardiologist, any specialty, you name it, you can do something in these places, in these countries, where the facilities are really suboptimal. First, you can help. Second, you can help in upgrading the system, being a bridge to somebody else who can do a better job later on. So spare part of your time. Those who cannot, at least tell others. They might be able to do this. If you cannot, and if you're not a doctor, again, the message is try to help by perhaps trying to donate equipments, medical equipments, go and buy them, tell others about them, try to recruit nurses, try to recruit doctors who really, a lot of them are around and they really want to help, they're willing to help, but they're not finding the right avenue. And physicians across continents has been always a good instrument to these good people to do this, this is being reflected through the long history of the physicians across continents in many countries. We're talking about almost 39 to 40 countries all over the world.